Okay, good morning, everyone. Welcome to the Health Services Committee meeting. First order of business is to approve last month's committee meeting minutes. Motion made by Supervisor McDevitt, seconded by Supervisor Frazier. All in favor?
Aye.
Opposed? Carried. It's a sad day today. We lost a member of our committee. He's now on social services. Oh wait, no, he's not. We're gonna miss you, Supervisor Taylor. Pat, go ahead, take it away.
I was all ready to welcome our new member, but I guess I'll...
He's running a little late.
Anyway, first thing on our agenda this morning, we have some new contracts that we need to request authorization for because with the managed long-term program. So I guess because they're different contracts, I put them separately. The first one is with VNA Home Care Options, and it's to allow us to provide services and receive reimbursement for them.
Okay, motion made by Supervisor McDevitt, seconded by Supervisor Frazier. Any discussion? All in favor?
Aye.
Opposed? Carried. Okay.
Okay, the next one, same deal. It's to authorize a contract agreement with Humana Choice Care to allow us to provide services and be reimbursed for them as well.
Motion made by Supervisor Frazier, seconded by Supervisor Conover. Any discussion on this? All in favor? Opposed? Carried. Okay.
And the last contract is to authorize an agreement with Elder Plan Home First Managed Long-Term Care. For the same reason, we're seeing more and more managed care organizations that want to get into our county. And if we don't have contracts, we'll lose the referrals and we'll lose the reimbursement.
Motion made by Supervisor McDevitt, seconded by Supervisor Frazier. All in favor?
Aye.
Opposed? Carried.
Okay, the next thing is to request a resolution to rescind the resolution that we did that authorized us to send a letter to the New York State Health Department to state that Warren County would no longer be the sponsor agency for WIC. And what has happened subsequent to that is that the Cornell Co-op mothership decided that they didn't want to do it anymore. So I know Dr. Seeley was disappointed, but we rallied and the application was submitted and the chairman signed it, so we need to have this resolution to ratify his actions, and business will be as usual.
All things happen for a reason, right, pal?
I guess so.
Motion made by Supervisor Conover, seconded by Supervisor Frazier. All in favor?
Aye.
Opposed? Carried.
Okay, next we would like to request committee approval to allow 3 of our staff to attend the ICD 910 Readiness Boot Camp in Albany, and that's because we're going to be going from ICD 9 to ICD 10 later this year. From August to October, we'll be running 2 systems, but because the ICD 10 coding system is way different, we really have to study and be up to date. And it's pricey, but we can't have just one person know that system. So we have monies to pay for that in the budget.
Okay. Motion by Supervisor Frazier, seconded by Supervisor McDevitt. Any discussion on this? All in favor?
Aye.
Opposed? Carried.
Okay, we don't have any pending items this month. And under information for discussion and review, you'll see attachment number 1, our emergency response report, which is kind of lengthy because it's reflecting, we didn't have a meeting in December, so it's a little busier than it usually is because it's reflecting 2 months. So if anybody has any questions, otherwise we can move on to status of referrals. Okay, status of under referrals, basically Sharon can provide comment. There's the report for the whole year, but we're in
overall, comparing us in 2014 to what we had referral numbers in 2013, we are only down 7% across the board. And in 2014, all new CONs were up and running. So I was extremely pleased with that because, of course, we expected to lose some. However, it was a total of 7%. And we're still our patient outcomes and satisfaction are still extremely high.
Very nice to hear. Any questions or comments? Okay.
and we had some visitors from the state last week, welcoming Sharon back from her vacation. We were lucky enough to not have them come while she was on vacation, but she walked into them, and they spent 3 days with us, and we did extremely well. They reviewed all of the things that they had identified when they came last time, and our plan of correction was 100% perfect, and, thanks to
They
Sharon.
told us that they really enjoyed coming to see Warren County. They enjoyed the relaxation of the staff and whatever, and, they said, and trust us, there are places we go to that we don't really enjoy going to. And I was so excited, I hugged one of them. And I have to say, I went home and said to my husband, oh my goodness, I've worked too long for the county. I hugged a state surveyor today. And when I came back the next day, she looked at me and she said, you know, the surprise on your face when you did that. Anyway, but we did an excellent job, and we should be extremely proud of our staff. They worked hard to meet all the regs.
And they did go on home visits when it was bad weather out, so they get a chance to really see how hard they work, so that's...
Up north this time.
Wow.
They thought they were going to Warrensburg because it was a post office box. They ended up in Johnsburg.
Oh, my goodness.
They were like, ooh.
That was like
Supervisor
somebody
McDevitt?
that came here, they thought it was 10 minutes between here and Indian Lake.
Oh,
my gosh.
I just had a quick question. Do they normally give you advance notice that they...
No.
Oh, they don't?
They
So-
don't.
So they just show up?
Yep.
Ooh.
When they do a survey every 3 years. We have to have a Department of Health survey, and they do it for Medicare. That's who they're doing it for. And so they don't announce ahead of time, but we kind of have a feel of, you know, every 3 years, well, they had to be here by a certain date, but they don't give us a notice. And then when they find deficiencies, which they usually do, and we go with a plan of correction, they have it anywhere from a year to return. They were there 2 days before they wouldn't have gotten paid for the survey from CMS, so you can kind of judge it that way, but you really never know. I just went like this, then. Every time I went on vacation, I was hoping they would come, but they didn't.
It's a nice testament. Good stuff.
Okay, reports of expenditures and revenues, and, the Mr. Conover report.
Attachment number 2 is, as of this week, a summary of 2014. Obviously, we don't really have any numbers to give you yet for 2015, but this gives you an idea. Books really won't be closed till like February, March, when probably most of the numbers will be in there. So this gives you a picture as of this week. You will see, which we usually look at again, the salaries. Overall, we only used 98.14% of our salaries that were budgeted, and compared to last year, we came under almost $10,000 in overall salaries. You will see regular salaries that are up a little bit over 2013, but that's expected due to normal CSEA union contract and increases. And we did have some positions that were open there, so we utilized per diem, and hence you will see some per diem line is up, but our overtime overall was down $28,000, which is really good, and that was due to utilizing a lot of the per diem for our nursing. And the next attachment, number 3, which is a comparison of last year and this year at the same time, you will see it's pretty consistent. One thing is, I know a lot of people ask, you know, our revenues aren't where they're supposed to be with budget, but you'll see this is where we were last year at the same time. By the end of the year last year, our revenues were over $9 million and our expenses over $11 million, so you'll see that we still have a couple months to still catch up. The 2 big things that will still be added to our revenues and expenses, a lot of things have already hit, our early intervention and primary preschool program. Again, we can't bill that until like around March. We'll get a form from the state to show all that we can book that revenue. That's usually close to $1 million. And then our WIC program, it's offsetting, but we also record both revenues, expenses for all the food vouchers and everything they do throughout the year. And that's just a number put on the books, but it still has to be reflected in our financials, and usually that's around $1 million too. So we expect, you know, that all to be finalized when the books are closed. That's pretty much it. We're still closed in December, and of course, at year end we have our grants and our state aid and other final things we have to do for the year for revenue, so you'll see those coming up.
Supervisor Conover?
Now, back on the year-over-year report, you would expect that 2014 year-to-date actual to, is that a final? No, that's not a final, so that's going to be more in line with budget.
Right, like I was just saying, the preschool and the WIC were,
The
usually
contractual.
probably at least another 2 million in revenues around, and then at least another 1.5 million with expenses expected, especially with the WIC program that's in, we put in 1 million revenue, we put in 1 million expense, we just have to reflect that on our financials, so it's part of these numbers. But, yeah, like if you see on the next report, they're similar to where we are right now, but you'll see on that report, we got up to 11 million in expenses and 9 in revenue, so just tells you within the next couple of months, we'll be up where we're supposed to be. It's just due to timing when everything hits.
Sure, I understand. Thank you.
Okay, also on attachment number 5, you'll see our last quarter, rabies report bites, which is pretty straightforward. We did have a meeting, with the town of Queensbury, and we're looking at doing some changes with our reporting and how we notify them of bites and how they communicate with us. So if there's more to say, we'll bring that up in the next month or so, but it's a good time of year to do it because it's a slow time. So,
Good.
I guess that's all I have.
Any more questions or comments for public health? Keep up the good work, ladies. Excellent.
Thank you.
Okay, we don't have Westmount on the agenda today, but, Travis Whitehead would like to address the supervisors. I do have some extra handouts here. Travis, go ahead.
Yeah, thank you. I'm just going to go through this real quickly. There's some handouts out there. There's 10 pages of slides. The slides are going to be, might be part of a presentation that are going to be put on by some people on the 11th of February at Queensbury. It's going to be a meeting ahead of the official public hearing on Westmount. But really what these 10 slides go to show is to try to clarify a point that was made at the December Board of Supervisors meeting with regard to a $6.5 million fine that Specialty Care claims has nothing to do with them. And I just ask you to take the time to go through these 10 pages. I think it's pretty much self-explanatory. But what you'll see here is that that's the mugshot of one of the 4 people arrested that day. Clearly shows she was working for a Northern Services Group. That she was accused of funneling $1 million in false claims of Medicaid. As it turns out, if you go through this thing, Northern Services is owned by Specialty Care, it's probably strictly true that you can't put the name of Rosenberg or Strauss or anybody else directly to this manor. But then again, you can't put them to us either. If you just turn to the very last page, the next to the last page, the one marked Northern Manor ownership on page 8, it shows that the only person they tie that to is a fellow by the name of Isidore Friedenberg in Suffern, New York. Well, if you turn to the last page, who did we sell Westmount to? It turns out we sold it to Isidore Friedenberg of Suffern, New York. So, nobody knows who owns what. I've gone through a number of Department of Health applications recently. I've actually filed a complaint with the Department of Health on Mr. Rosenberg's activities, and he has constantly changes the story as far as what properties he owns, and it's consistently ignores the ones that have quite a bit of problems associated with them. But I thought this would be interesting for you to take a look at and just, consider that when you do business with a person, it shouldn't be that he didn't lie strictly in a court of law, and that might be the case here, but he didn't tell you the truth, and I think that's pretty clear. Thank you.
Supervisor McDevitt?
Yeah, I would just like to, for the record, point out, I don't think that too many people disagree, with the sale of the, Westmount facility. So that is not the issue. The issue is, are these folks, the people that we have contracted, are they ultimately going to provide the quality of care that is necessary for our residents? My belief is that they will not, and that essentially we have got to take that into consideration. I think, for the public record, when we voted that day for inking our contract, Supervisor Beatty apparently had a telephone conversation with Mr. Dusick, and I'm guessing it was with this gentleman referenced here, Mr. Abramczyk. And Mr. Abramczyk told him that they basically were not, that they were only in a consulting type format. Council was asked at that meeting if indeed it is ultimately proven that Mr. Abramczyk was being less than candid in that telephone conversation, it would give distinct cause and legitimacy to voiding that contract. So, I believe that the folks that we have contracted with are not good players. I believe we missed a golden opportunity not to contract with the group from Fort Edward. The group from Fort Edward, Fort Hudson, 30 to 40% of these folks live in Warren County. They pay taxes. We know who these people are. They have an excellent track record, and that clearly would have been my option. Thank you.
Vice Conover, did you? Looked like you had, okay. Travis, thank you for bringing this to our attention. We'll definitely look more into this.
Thank you.
Appreciate it. Okay, Rob, you're next on the agenda.
Thank you, Mr. Chairman. I have some handouts as well.
Thank you.
Pass those down.
Oops, there's another one.
Oh, I'm sorry.
Have enough?
I think you're right.
Or 3, or 4. You can take some home.
I'll run off anyway.
Biggest stupidity you've ever had.
You're way ahead of me.
All right. It's a good
Rob will go.
Any preference for where I stand or sit?
Wherever you like, my friend.
That's always a good play. Okay.
Got the audio-visual backup just in time for you.
Good. Okay, well, good morning, everyone. My name is Rob York. I'm the Director of Community Services for both Warren and Washington counties. A little bit new this year that we're folded into health, which I welcome, and it's a great opportunity. More and more in the mental health, behavioral health arena, we're talking about integrating services for behavioral health with health services and primary care, and so I think it'll be a good fit. Okay, so I thought what I would do first is I do have a packet here for you with the agenda for my portion, but I also have attached the PowerPoint slides, so if it's easier to look at them in the handout, feel free, and I will run through this. This is a presentation that I did for the Mental Health Committee toward the end of last year, but I updated it for 2015, so I apologize if some of you sat through it recently, but a little bit of the information is new. Okay, so for anyone who's not very familiar with our office, we are a shared office with Washington County for administration and oversight of mental health services, substance abuse services, and developmental disability services within the two counties. There's a slide 2 here, shows our organizational chart of our office. We have 5 employees, including myself. You can see our office specialist, Cindy Wasson. Our Deputy Director Clinical is Megan Johnson. Deputy Director Fiscal is Harry Carlson. And our Program Analyst is Lisa Kutu. Okay, primarily we work with 3 state agencies that we receive funding from. The New York State Office of Mental Health, the Office of Alcoholism and Substance Abuse Services, and the Office of, for People with Developmental Disabilities. And I'll get into some of the funding in a few minutes as to what that looks like. The way that our office is organized is dictated in mental hygiene law. New York State mental hygiene law directs local governments, which are counties, to either provide or arrange for preventive, rehabilitative, and treatment services for mentally ill, developmentally disabled, and those suffering from alcoholism and substance abuse. In Article 41, it requires the establishment by counties of a local government unit, given authority in accordance with Article 41 to provide or arrange for those local services. So my office, the Office of Community Services, is that local government unit, given this authority by both Warren and Washington counties. Okay, so we are sharing services in a way. You know, there's a lot of talk now about sharing services, and we've been doing this for a long time. In fact, we're unique in the state of New York, in Warren and Washington counties coming together and doing this. Warren and Washington counties have executed an intermunicipal agreement which details the sharing of one administrative office. And the way that works is our administrative costs are totaled and split evenly between the 2 counties, and there's through an annual chargeback mechanism to Washington County. Okay, Article 41 again of the Mental Hygiene Law requires each local government unit to have a community services board. So both Warren and Washington counties have community services boards. In counties with populations of less than 100,000, the CSB can be either 9 or 15 members, and our counties each have 9-member boards, and the members are appointed for 4-year terms. The officers are elected for 2-year terms. And then I put a slide in here that shows the current membership of the Warren County Community Services Board. Our most recent appointee was Maureen Schmidt for Commissioner of Social Services. And there's a resolution request I'm going to present today to fill a vacancy on that board. And then I also included here a slide that shows the membership, current membership of the Washington County Board, just informational. Okay, then on slide 10, Article 41 requires the direction and administration by each local governmental unit of an annual local comprehensive planning process. And we have a subcommittee structure that we accomplish this through. This is our annual plan that we submit to the 3 state agencies that I mentioned. What the subcommittees does is it allows us to bring our local providers together, together with recipients of services and family representatives to plan for local services. Okay, moving on to slide 11. This just shows our 3 separate subcommittees. What we've been doing for the past year or so is the mental health and the substance abuse subcommittees have been meeting jointly because there's so much crossover between the 2 fields, And, there's more and more talk about integrating services, not just health and mental health, but also substance abuse and mental health. And, so that forum has worked well, bringing those together. So on to slide 12. The subcommittees provide venues for service system planning, implementation and coordination of local services, provider collaboration, information sharing, and multi-stakeholder problem solving. Subcommittees are comprised of CSB members, our Community Service Board members, staff from the office, service providers, service recipients, family members, as I mentioned, and they meet quarterly throughout the year. Because we're a shared office, we lease space from one of our contract agencies, the Warren Washington Association for Mental Health. So our offices are actually located downtown in Glens Falls, and that actually works out pretty well for us because it's centrally located between the two municipal centers, and we're able to go back and forth for various meetings at the two municipal centers. Let's see, it looks like it would be slide 14. I provided a table here that shows our contracts. As I mentioned in an earlier slide, mental hygiene law directs counties to either provide or arrange for services, and our counties arrange for services through contracts with local not-for-profit agencies. Warren and Washington counties are not direct providers of services, so you may hear from some other counties, issues about their mental health services or their clinics, that they're operating as a county operation. Our counties don't operate any services. Let's see, I gotta catch up my slides. I don't know why these... So anyway, in the handout you can see it, that it's approximately $2.6 million in contracts that we hold with various local community not-for-profits that provide a range of services across those three disability areas. And then I provided a slide with some information about their websites. All of these agencies have, more information on the web if you are interested in, looking to see about their services. It's easy to look them up. Then I also provided a slide here just to illustrate that primarily the funding that I'm talking about with that $2.6 million is primarily state aid that flows through our office and sort of through that local planning process that I talked about. There is a portion of county tax levy in that, and so I provided a table here just showing you a pie chart here of the sort of the slice of local tax levy is about $46,000. And then the next slide shows you how that 46 is distributed across three of our contract agencies. And the local funding that's in this primarily goes for support services and pre-vocational services through these three agencies. Some additional responsibilities that we have are the fiscal management and reporting back to the state for the funding. Single point of access process. We operate a referral process for services that tries to match, limited services to the highest need individuals in the community, and that's called single point of access. We operate an assisted outpatient treatment program. This is a program where individuals in the community who meet certain criteria for past dangerous behavior related to non-compliance with treatment, they can be court-ordered to comply with outpatient treatment. And so that's what assisted outpatient treatment is. We review and approve certificates of need for expansion of services. We have responsibilities for overall system coordination among the contract agencies. We do emergency removals from the community if someone's deemed to be a danger to themselves or others. They contact us, and we have a process with local law enforcement to remove people from the community who are in imminent danger and get them to the hospital for evaluations. I also coordinate a county disaster mental health team that's coordinated with Brian and Amy's office, the Office of Emergency Services. So we have a team of about 26 volunteer clinicians from the community that are available as a resource to the county. You know, if there was a need for mental health response, these folks have been trained specifically in disaster mental health response. We have some responsibilities under the SAFE Act. Clinicians and physicians are required under the SAFE Act to report if they feel someone is likely to engage in dangerous behavior, and then those reports come to my office, and we then forward them on to the DCJS, the Division of Criminal Justice Services. And then just active involvement in various regional healthcare planning structures. I included information on our web pages as well. We do try to keep our information up to date on the county websites, and my contact information is there. I'm happy to answer any questions or be available to a resource for any of the committee members as well. Really at any time, feel free to call me. Any questions?
Appreciate the overview, Rob. Supervisor McDevitt, I'm sure this was repetitive for you, but do any of the supervisors have any questions or comments on the show for Rob?
Good presentation.
Yeah, yep. Good quick overview.
Okay.
Okay, let's continue with your action agenda then, Rob.
Sure. Okay, the first item on here is a request to approve a resolution appointing Holly Erie and Sweet to the Warren County Community Services Board for a 4-year. She's actually stepping into a 4-year term that's unexpired, so she is going to, her effective date of appointment would be the date of the Board of Supervisors action, which would be February 20th, and she would fill that term through the end of the year.
Motion made by Supervisor Conover, second by Supervisor Frazier. Any discussion? All in favor?
Aye.
Opposed? Carried.
Okay, the second one is appointment of 2 members, Joan Grishkot and Barb Boja, for 4-year terms, and these are 4-year terms that would technically run January 1st of this year through December 31st of 2018.
Motion made by Supervisor Frazier, second by Supervisor McDevitt. All in favor?
Aye.
Opposed? Carried. Okay.
Okay, next I have a resolution request to approve an acceptance of $100,000 in state aid from the New York State Office of Mental Health that we're looking to add to the Parsons Child and Family Center contract. This is to expand a home-based crisis intervention program. What this program is it's an intensive in-home program where clinicians can respond and be involved short-term in the home, designed to de-escalate crises, avoid people having to go to the emergency room and seeking hospitalization. So it's a preventive service. This is another one that's a little bit unique in the sense that we are collaborating with Saratoga County on this. It's a tri-county program, Warren, Washington, and Saratoga, and Warren County is serving as the fiscal agent. So the $100,000 is not exclusively for Warren County, but we jointly administer the program among the 3 counties.
We like money, Rob, just so you know.
I know.
Motion made by Supervisor Conover, second by...
3 and 4.
3 and 4?
I think they're related, aren't they?
Can we move both?
Yes.
3 and 4.
What's that, John?
Well, no, actually, it's a separate program, I'm sorry.
It's separate, all right, so I'll move 3.
Okay, motion made by Supervisor Conover, second by Supervisor Frazier. Joanne, you had...
Yeah, Rob, do you also have to amend the contract for that?
We,
You're amending the budget, but do you also have to
Yes.
I think we've talked about that before. You'll need permission to amend the contract also.
Okay, so I guess we'll amend the resolution to do both, can we do that? The
I'll see
budget
why
and the
not.
contract?
I thought the contract allowed for, monies to come in during the year without further amendments, that we just had to amend the budget, but I can.
I think we have a blanket resolution that we approve at the
But we
beginning
get
of
one.
each year that says that no further resolution is needed to amend the contracts.
Oh, okay.
Because we sometimes do move
Alright.
money around within your different contracts, so I think that the resolution allows for that, we would just need to amend the budget.
Okay.
Thank you.
Okay, so we'll keep the motion as is. All in favor?
Aye.
Opposed? Carried.
Okay.
Item 4?
Number 4 is, approve a resolution authorizing, my office to enter into an intermunicipal agreement with Washington and Saratoga counties, detailing the operation of a Tri-County Children and Youth Mobile Mental Health Crisis Team. This is a similar program, but this is new monies, that we would be receiving, for actual child mobile mental health crisis. So people would have like a number they could call, and there would be a same-day response, of a clinician who would go out to the home, try to de-escalate, the crisis. The difference between the two programs is the home-based crisis intervention stays involved with the child and family, for a period of maybe 3 to 4 weeks, and they go in repeatedly over those 3 to 4 weeks. The mobile mental health service is really just designed to be a same day in and out, de-escalate a crisis, try to avoid, emergency room use.
Okay. Motion made by Supervisor McDevitt, seconded by Supervisor Frazier. Any discussion? All in favor?
Aye.
Opposed? Carried. Okay.
What I'll be doing is I'll probably be coming back, we're going through a process right now of issuing an RFP for these funds, and once we issue the RFP, make a selection, then we will be coming back to establish a contract for these services. Okay, and then number 5 is a request to approve an intermunicipal agreement with Rensselaer, Saratoga, Schenectady, and Washington, detailing a similar program for adults, an adult mobile mental health crisis team that would be a same-day in-and-out service. It would be a regional service among the 5 counties, and Rensselaer County is acting as the fiscal agent for this, so they're receiving the funds, but through the intermunicipal agreement, we'll work out a mechanism for the 5 counties to manage it, oversee it, make sure that, you know, we're getting sort of our share of the services.
Okay, motion made by Supervisor Conover, seconded by Supervisor Frazier. All in favor?
Aye.
Opposed? Carried. Okay. Anything else, Rob, or
That's all I have.
all good? Any questions or comments from anyone? Okay, motion to adjourn. Motion made by Supervisor Frazier, seconded by Supervisor Conover. All in favor? Opposed? Thank you.
Thank you, Rob, appreciate it.
Thank you.
Did you get your plow yet? Right.